So, I am going to tell you a story about my most recent hospital visit. This is going to be a long story, and if you need it, here's your trigger warnings. I guess I'm going to talk about periods, miscarriage, medical malpractice, birth control, IUD, gore, lots and lots of gore. So yeah, that's your warning. So this is my saga with my miscarriage, and I'm gonna actually be reading from my journal. The reason I started this journal is because my fiance and I actually want to have a baby, and since I am at an advanced age, I'm old enough to not remember how old I am. I'm 36, I'll be 37 in a couple of months. So this took place a couple of months ago, and I'm just now getting around to talking about it because it was traumatic, and I kind of forgot a lot of it. This journal was to keep track of my health and, you know, make sure that I'm checked in mentally and physically, just like, you know, keep track of everything that's happened. So without further ado, it all started when I was a teenager and I had debilitating cramps. Ladies, a lot of you have been there. They were so bad, I just could not. I remember one instance in particular when I was in Ireland with my then high school boyfriend and his family, and I could not get off the couch for the entire day. So it was like, sticks out in my mind in particular because I missed an entire day of sightseeing. But yeah, it was bad. So my mom and I talked to my gyno, and we made the decision to put me on the birth control pill. I was 16 when I started the birth control pill. Now, I will admit, I don't remember that far back. I was still a minor, so my mom was kind of in charge of me. I don't know if there was ever a conversation about, you know, being careful about like how long you stay on the pill or what. I kind of think no, because my mom was also a nurse back in the day. She took my health very, very seriously. Cut to, I ended up being on the birth control pill pretty much my entire life, from 16 up until 2020. In 2020, before the start of the pandemic, I had an IUD put in. And the reason why I did that is because, again, trigger warning if you need it, the birth control pill messed me up. I was having a horribly painful sex. My hormones were just like, I don't know, non-existent. I didn't know this though for the first like couple of years. I didn't know what the issue was. I just hated sex. It was very bad. Yeah, then I finally found a gyno who was like, maybe, you know, we should, she also told me that my uterine wall lining was like a third of the thickness that it was supposed to be or something like that. I don't really know. But she recommended that I switch to an IUD, and which gives a Mirena, in case you're wondering, gives a really, really low dose of hormones. And that was fantastic. I had the IUD in for 3 years. And it was the best because I no longer had a period. So I didn't have to worry about reverting back to my 16-year-old self where my periods were horrible. But I also didn't have to worry about birth control. Yeah, so then my fiance and I, like I said, we want to have a baby. We decided it was time. So I had the IUD taken out, and now I'm gonna start kind of reading to you from my journal, and you can follow the series of nightmares that followed. So on August 4th, that's this past August, 2023, I had the sex. It was enjoyable, blah, 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 blah. Then I went to get my IUD out later that day. I felt rushed through the appointment as per usual, but it didn't hurt anywhere near as much as it hurt getting it put in. I remember when I got it put in, I was like, to the ladies, I was like, this has to be worse than childbirth, right? And they were like, girl, please. So I got it taken out. I started cramping immediately, but it didn't last more than like a minute. Put in a pad, blah, 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 and went home. August 7th, had the sex for the first time with no IUD. Now, as you probably can tell, I get pregnant. Now, I don't know when this happened, but it's very possible it could have happened either of those times. Before I got the IUD out or right after. Oh, I got this cool ring, Aura ring, started using it, tracks all kinds of stuff. Skipping ahead now, I recorded, you know, all the times that I had sex, whatever, because I'm keeping track of it. Keeping track of my mood. August 31st. Had sex that day. Dripped out the teeny tiniest bit of blood. along with some other stuff. I'm eager to get my first period, yay. And it's a full moon, because I'm a nerd and I wrote that. September 16th, another tiny little bit of blood. Tiny bit. I was also uncomfortably bloated, but it seems like I'm not really starting my period for real, even though I was crazy tired and emotional that day. Next day, started my period. It was really gross looking. It was a slightly purple-ish, like a lilac-y. I did warn you there's going to be gore, so strap in. It looked like, you know what, had solidified and mixed with the blood, though it was probably just my uterine wall clearing itself out. I'm definitely cramping, but it's not that bad. Next day, September 18th, blood looks more normal. I'm sluggish all day, partly because of period, partly because of the rain. Cramping is the worst so far right now, right before bed. Next day, September 19th, third day of period, but it was super light. Didn't even use a tampon. Slight cramping still. I think this might be the last day. I'm tired. Next day, September 20th. Wow, so I really thought my period was going to be light like it used to be, and then it was essentially over, but nope! Today, while I was stressed and way too busy to handle it, the floodgates opened. The purest, reddest blood just poured out. I've only been wearing a tampon at night for the past 2 nights, but today I had to really keep changing it. Also, my boobs have really hurt the last 2 days, and I was definitely PMSing. Next day, September 21st. Can't believe I'm still bleeding. Still very red. Only really actively bleeding when I'm moving around. The bloating is the worst part. And not being able to pass gas. The cramping is not nearly as bad as it had been in the past, but I've never had this many other symptoms before. I'm kind of over it. Martin is at least being nice to me and not complaining about a lack of sex. I'm super, super tired. September 22nd. Can't believe I'm still bleeding. Had some clotting last night right before bed and again today. Bled through several things at this point because I'm not used to not being able to move around without flooding. The neighbor's dogs, I took on 2 walks today and I finally got some farting out. Next day, September 23rd. I really thought I wouldn't have to buy tampons for like 6 months, but I'm going through them like crazy. Pure blood. Ruined my first pair of pants today. September 24th. Still bleeding. It's now officially been a whole week and it doesn't feel like it's going to stop. Even felt lightheaded and weak because I've lost so much blood. Next day, September 25th. Today was awful. I was lightheaded and nauseous all day, and what's worse, rocket peed on the couch, and I had to spend the whole day scrubbing. I feel so sick. And I don't want to jinx it, but I do seem to have stopped bleeding, mostly. Next day, September 26th. Yep, still bleeding. There was one time today when I was pulling out my tampon, kind of dry, and I literally felt like I was pulling out my uterus. Oh yeah, and I bled through my tampon in my sleep last night. Luckily, it only got on my underwear. Next day, September 27th. Okay, so it's like I'm on my 3rd period in a row, except I haven't stopped. Towards the end of the workday, I bled through my underwear and pants again. And when I went to sit on the toilet, it was just like a faucet was turned on, just dripping and dripping through my tampon. Then when I pulled the tampon out, there was the biggest clot. And so gross, I threw up in my mouth. Then I was cramping the rest of the night, still wearing giant pads on top of a tampon because I'm so tired of washing blood out of my clothes. Just to, you know, skip back a little bit. I never had bad, like, as far as the bleeding, my periods were never that bad when I was young. I really didn't bleed that much. It was just the cramping that was bad. All right, next day, September 28th. Day 12, now concerned. Again, for most of the morning, I thought it was ending. Then around 4 o'clock, it started getting cramps and stomach aches again. Went for a few hours in the evening without a tampon and just a pad, and I was fine. And then I peed and wiped and got huge clotting again, like so gross. Called my gyno early in the evening because I'm starting to be concerned. They recommended I come in tomorrow. Of course, it was an answering service. I said, I'll probably go in tomorrow, but I'll call ahead. My gyno is an hour away from me, but by the way, Google says I might have cancer. Probably had the most painful cramps of this whole experience while I was making lunch. Could hardly get through it. September 29th. I'm actually writing this on Saturday because I was too exhausted. So I had a hard time getting into bed because of the cramping. Then I had a hard time getting to sleep because the cramps were so bad. I texted my boss that I was still awake, and if I can finally get to sleep, I need to keep sleeping. That was probably around like 3 a.m. I texted him. Heating pad finally allowed me to drift off. I woke up about an hour later and had to go to the bathroom. I didn't have any tampons or pads in the bedroom bathroom, so I then moved to the hall bathroom, and there I stayed for I don't know how many hours. The cramps were hands down the worst I've experienced in my entire life. They were so bad, and I had lost so much blood that I passed out twice and threw up once. The blood gushed out like a faucet, as well as giant chunks of clotting. I was also diarrheaing like crazy, but even though it was mostly liquid, I still had to push it out. And whenever I did that, more blood would gush out and cause the cramps to get worse and cause me to get more and more lightheaded. My body was literally warring with itself. My insides were just falling out. At one point, the pain was so bad, and I knew I was on the verge of passing out, that I was trying to scream for Martin, but he couldn't hear me. That's because we keep a fan on in our bedroom. So I didn't have a phone with me, and the fan was by his head, and I could not physically scream for him. I tried banging on the cabinet doors beside me, but the doors would then open and not make enough noise. So I banged on the fake unit right above it, and I knocked it completely off onto the floor. That Martin heard. So he got me some water and watched me pass out twice. I told him a long time ago that I usually pass out right after I throw up, but this time I threw up right after I passed out. He suggested a bath. He ran it and put a bunch of Epsom salt in it, and man, that did the trick. I don't know why it worked so well, but the pain was instantly gone. I got back in bed with Rocket and a heating pad and fell asleep half sitting up. Meanwhile, my boss took Martin to a couple of stores and got all the period stuff he could think of. I slept for about 3 hours, but I was woken up by something every 20 to 30 minutes. It was flooding outside and we were getting emergency alerts on my cell phone. My boss's sister's fiance came over with a blood glucose test, testing my sugar. He said that because I was eating, and even though it was only crackers at that point, that spiked my blood sugar. I need a hemoglobin test. Anyway, this was the worst pain I've ever experienced. This lasted the whole night and made me pass out twice. All right, next day, September 30th. Today was better. There's no comparison. Started the night in the bedroom with the heating pad. After about an hour and a half, I had sweat through everything and couldn't sleep there anymore. So I changed my nightgown and slept pretty solidly through the night in the office. I have a bed in the office because Martin snores. I had crazy diarrhea again. It was like a faucet. Still had to push it out though. The second time I had diarrhea, I had just put in a light tampon like 20-30 minutes before, and the string was bloody, so I thought I could pull it out, but it was still dry. Fellas, if you're listening, I'm sure you're gonna learn a lot. And it broke off. It broke off. Like, it snapped off inside me. Then I utilized the diapers Martin got me so that I didn't put another tampon in. Cramp pains are about half from what they were yesterday, from a 12 to a 6. Super tired today, took 2 naps. Being in this much pain is exhausting. I forgot to mention during the worst night ever, last night, I was also violently shaking, partly because it was so cold in the house, and partly because I was exerting so much energy trying not to pass out. That was the other reason the bath was a miracle. We're skipping October 1st. Felt so much better today, was barely cramping, very light bleeding in the morning, but afternoon it was back to this thick, syrupy, burgundy, stringy stuff. I was fine all day until right as I was about to eat dinner, then a blood red waterfall started. I got through dinner, spilling into a diaper, then I went back, sat on the toilet, and a giant clot popped out, like 10 times the size of any others. Martin said it could be a miscarriage. While not impossible, it would be crazy unlikely. I took a video of it, sent it to my mom. I'll have to go to the gyno tomorrow. I took iron, B12, and magnesium for the 3rd day. Had 2 more giant clots pop out in the shower, and then 6 more in the toilet. It honestly made me so sick. Right as I was trying to get ready for bed, I had yet a new blood experience. It was pure liquid. It looked like Kool-Aid, and it would not stop. I'm gonna take a little breather right here because this is where the story gets crazy. I should have said at the beginning, this video is not safe for children and not safe for work. Okay. F this day to H. Seriously. Okay, so I fasted and I went to the gyno this morning. I tried to get there early so they could draw blood and then I could eat something, but no Uber would pick me up in time. But I did tell them right away that I was fasting and hungry. Apparently she didn't take my word for it. More on that. So she did a urine test and surprise, I had a miscarriage. And as it turns out, that's what this was the entire time. I have not had a period yet. She did a sonogram too, and it basically probably looked fine. Took blood, complete blood count, and also because she couldn't see those results right away, and she couldn't see if I was anemic, she wouldn't give me the medication that she said I needed. So she told me, based on her expert opinion, that I don't look stable. She said I looked very pale. Duh, I am. And my nail beds look blue. I didn't think so. And my lips look blue. Okay, no. She just didn't know what I looked like normally. I do normally look like a vampire. Even this light makes me look tanner than I actually am. I'm very, very white. Then I wrote, I'm continuing this the following day because I'm a mess. So I had Martin meet me at the gyno because she wanted to send me to the ER based on how I looked. And I wanted her to retell him everything that she told me. I was trying to assure her that I would feel much better if I could just eat a meal. Because remember, I fasted because I knew she was gonna draw blood. So it was in the morning, I was dehydrated, I was hungry, I looked probably like death, but I needed a meal. I did lose a lot of blood last night, I got no sleep, and then I fasted and I rode an hour to get there. I told her I was going to Arby's while I waited for Martin to get here. She didn't even want to let me walk across the street to get my own food, so she had the desk lady get it for me. She called the hospital ahead of time and told them I was coming, and they informed her a doctor and an actual OBGYN would be there receiving me. I ate in the very, very hot office while I waited for Martin. I pushed the chairs together so I could lie down. Martin got there, I told him everything, and then we went to see the PA together. Mind you, if I haven't said this already, my gynecologist, whom I actually really liked, I was with her for a couple years and then she franchised. So now the place that I have been going to, I never actually see her. It's always a PA. And I also, every time I call, like probably 70% of the time when I call the office, it's an answering service. American healthcare. Anyway, so she told Martin everything again. We then went to Arby's together so he could eat, and thank God we did that. And I got a milkshake because I was still, whatever, squeamish, and we talked over our options, and we decided together, all right, let's go to the ER. We arrived at the hospital at 2:33. We weren't sure where to go. We were ushered through the metal detectors and then pointed down the hall to the registration. The lady at the desk dismissed us right away, pointed behind us, and told us to put on a mask. She could not possibly be pointing to this open box of cloth masks that everyone's been touching. I almost walked right out from this offensive stupidity, but we put it on. We were pointed to this desk right next to it, and the other lady asked why we were there. I told her I had a referral and my gyno called ahead and the ER is expecting me. She didn't want to look at the referral, so I had to try and explain it to her the best that I could. Then we made this weird little triangle thing to all these desks, and we're pointed right back to the registration lady, where she then had me take down my mask so she could take a picture of me. And then we were sent to the waiting room, where we remained for the next 5 hours. Sitting in the waiting room was its own form of torture. The chairs were super hard and uncomfortable, it was packed, and after a while, I had been to the bathroom to change so many times that I was just about out of products, which I told them several times. Martin kept stepping out to make phone calls, but I couldn't get up anymore at all for fear of another waterfall and lack of products. I was glued to my chair, and it was an odd, horrible feeling. At 5 o'clock, I said we should go. Martin's dad showed up at 4 o'clock to pick us up. At 6 o'clock, I said we should go. At 7 o'clock, I said we should go. I had had enough, and I cried. Mind you, when we got to the ER, I was fine. I had had my food. I was really not wanting to go to the ER because this was not the kind of emergency, but after sitting there for 5 hours, I was not okay anymore. At one point, Martin stepped out and twice and called the hospital itself and said he wanted it on the record that they knew ahead of time that I was coming and that I hadn't eaten and been bleeding and that I'm getting worse under your care. He basically made that phone call twice, and it seemed to light a fire under their butt because then they called me back before he hung up the second time. I had already refused the wheelchair when I checked in because I was walking fine and I didn't want to get charged for it. A guy with a wheelchair showed up and just said, have a seat. So I kind of felt like I didn't have a choice, but I would also come to desperately need that thing. I do wonder though, if I had taken the wheelchair when I came in, if they'd maybe seen me sooner. I guess I'll never know. So the first lady that took my vitals seemed to say that I looked fine. So picking back up, when the guy put me in the wheelchair, I told him my fiance is coming and he said, no, he's not allowed back. But then a few minutes later, Martin did come back and I was so grateful to have him there with me based on how poor they were treating me and everyone else. If it would have been a whole lot worse if he hadn't been there. Yeah, I fully believe that. So I was put in the long hallway of the ER along with tons of other people. It was packed. Martin found me, a nurse showed up. I can't remember her name, but she was one of the only people that I would end up seeing throughout the night that was actually nice to me. She did my vitals and she said my blood pressure was a bit soft. And she stuck me with the implement to be able to connect the IV and also draw my blood. And it hurt. I would come to complain about it numerous times throughout the night, and for a good reason. While I was still breathing through the pain, she did a COVID swab in my nose, first time I've had that done, because I've never had COVID. Where she stuck me, I would develop a huge bruise a week later. A guy from patient relations came and introduced himself to Martin. I don't remember his name, but he was wearing clothes with the hospital branding. He said he knows that you called and it's been taking a long time and that you're not feeling well now, and they were gonna take care of me. And then the resident doctor, I won't name anybody, came and introduced himself, but I was really in too much pain in that moment to pay attention. The nurse then drew what Martin recalls was like 5 to 8 vials of blood from me, after which point I started shaking obviously, from being so cold and weak with no food, and she just took a bunch of blood from me. So Martin went over things with the doctor, and we gave him my referral papers from the gyno, which also had information in there that I would want back, but by the end of the night, they would have lost. Martin explained to him a few times, many times over the course of the night, that when we were in the gyno, they basically told us that I just need this medication and that it would make me feel better, but they wanted the blood test and the vitals to be confirmed that I was able to get this medication. And it seemed like he kind of disregarded that. On the form, it said I might need a blood transfusion, to which I told him I did not want it for religious reasons. And over the course of the night, it felt like they were very prejudiced against that because they kept repeating it over and over and over, as opposed to just doing things that would have helped. Like they could have given me the iron much earlier in the night just to build up my strength. I also probably should have asked if they thought it was a good idea to draw that much blood then, because remember, my gyno had already done it that morning, so I'm already like losing a lot of blood. And I'm just gonna go ahead and say it. It was not for religious reasons. Though I could make that argument. It's because they don't separate blood. If you know, you know. Whatever. So they connected me to an IV after I started shaking, after the blood was drawn, and gave me a blanket that Martin wrapped around me as best he could. I sat around for a while, not sure how long. They told me the gyno would be there soon. She was in surgery doing an operation. Finally, the resident doctor and nurse showed back up and wheeled me into a private room. They said I needed a pelvic exam. They said at the time that my hemoglobin was like a 9.7, which I guess was okay, wasn't great, but wasn't bad for what was happening to me according to them. He put in a speculum, he saw a blood clot, and for whatever reason, he didn't have the materials that he needed, and Martin heard him whisper to the nurse, "What could we use? What do we have?" And he was clearly very inexperienced in gynecological medicine, and he said to her, "Get the suture kit." And whatever he ended up using was not what he was supposed to be using for a pelvic exam. He tried to get the blood clot out and couldn't. He was scraping me, and he said, "Can you push?" And I said, "I'll try." I remember saying that because I could barely get the words out. I was in so much pain. So I pushed, and it was an indescribable pain. I literally felt like I was giving birth. And then I felt a waterfall of blood pouring out of me. I could hear it too, pouring out over the edge of the table. There was also another nurse or doctor who popped in before the pelvic exam with a really bad attitude, and we never saw her again. Or maybe we did for a hot second when I was brought back in the room later. Once the pelvic exam was completed, the nurse and resident doctor left. I continued to bleed pretty heavily. Another nurse popped in to relieve the other nurse for presumably her lunch break. Instead of just leaving us in that room, which had a bathroom and somewhere I could lay down, she wheeled me back out into the hallway to be by the nurse's station, and she was pretty impatient while I was trying to get dressed and clean myself up. All right, so just to recap. Waterfall of blood. No one's helping me clean except for Martin. I have blood all over my legs, all over my everything. IV in the arm where she stuck me. Super, super painful all night long. I couldn't bend or straighten my arm without extreme pain, so getting dressed, very, very hard. So we waited there. The nurse came back with some medication that was in a little like break-off box. She was about to give it to me when Martin mentioned that he thought the oral medication was not what it was supposed to be and that we were told that it would be rectal. She then backtracked after almost giving me that medication, and we don't know if it would have helped or hurt, but they were so disorganized, they almost gave me the wrong medication. Finally, the original nurse came back from her lunch break, and she gave me the suppositories to go in my butt, along with some gloves and some lube. And then I was on my own. I asked her if I was just gonna poop this thing right back out, and she assured me I would not. So I was directed to go into the bathroom, the one that 100 other people had to use, and put them in myself. And again, with how I couldn't fully bend or straighten my right arm, combined with all of the clothing and material that's now hanging off of me, hospital gown, blanket, my purse, it was very laboring to do it myself. Plus, I was extremely lightheaded from all the blood loss. So I wasn't able to go very quickly. Plus, if you've ever had to put something up your butt by yourself. So after a while, there's a knock at the door, and it's Martin telling me that the gyno is here. I don't know what time of night that was, but I want to say maybe 11. After a while, oh, I just read that. In the meantime, while I'm not there, Martin tries to fill her in on everything to make the process go smoother, but she seemed to have no interest in speaking with him. She was very annoyed that I wasn't there and ready yet. She had her head in her phone, wasn't communicating with Martin, wouldn't listen or respond to him. I'm not going to say her name, but That was also the name on my discharge papers, but when we looked the name up, it didn't look a thing like her. So all the while, we had known from my gyno that we basically just needed to go to the ER to do a sonogram and check my blood work, and if everything was cleared out from the pregnancy and my blood work was okay, they should have just been able to give me the medication and be on my way. But they still hadn't done the sonogram up to this point, and it really felt like they were either so disorganized and uncommunicative with each other that no one knew what I was even there for. Or they did know, and they were deliberately dicking me around to try and make as much money off of me as possible. Again, American healthcare, love it. So I'm done with my suppositories, and I'm wheeled back into the same room I was in before, and during that time of at least an hour, no one had cleaned up any of the blood from when I was in there before. And this is when, the same time, that nurse might have popped her head in. I don't know if it was the same, could have been yet another nurse, I don't remember, but she popped her head in the doorway and says, "Whose blood is this?" Like, appalled. And then she looks over at me and says, "Oh, it's you," and leaves. Like, so the gyno did another pelvic exam, and this one was a lot easier on me because she actually knew what she was doing. She inserted something with a light, and they basically wanted to clean me up to make sure there was nothing remaining in there, which they could have maybe just checked with the sonogram. So I don't know why they had to poke and prod at me again, but she went in there, cleaned me out, got the blood clot out that the other doctor could not get, who had no business being near a vagina, and basically said, "All right, you're clean." She didn't see anything bad in there, but for the next hour, they would have to monitor me to make sure my bleeding levels don't increase, because if I continued to bleed a lot, they would have to do emergency surgery on me, DNC, dilate and curettage. And also, during the process of me trying to relax, my suppositories started slipping back out, and the gyno shoved them back in. Oh man, and that hurt. The gyno had an assistant with her. They both left, and I sat up and started to step down off the table. I was already bleeding a lot, which they saw before they left me and said it was fine, but it started to ramp up while they were gone. The assistant came back, had me kind of lay back a little bit, asked me a bunch of questions about the Thursday and Friday before, basically the whole miscarriage experience of, did you know you were pregnant? When did you know you were pregnant? I pulled out my journal to be able to answer the questions more accurately, and as I was looking at the journal, I started to bleed a lot. So much so that it got all over the floor, all over the nurse, all over Martin's shoes, which is when he started to silently panic about this being very serious, and the nurse started to visibly freak out. Martin could see it in her eyes. That's when he started to freak out because he assumed it meant we were going to surgery. The nurse called somebody who might have been the gyno and told them everything that was going on. She was in a panic, and the gyno said, "No, get her to the sonogram." So they wheeled me into the sonogram room. A lady that did my sono, she was nice and pretty communicative with me. I told her I had already had it done earlier that day, the top part on my stomach and the insertion. She asked me if I would like to do the inside part myself and hold the camera, which I thought was very nice, but literally impossible based on the fact that I was propped up on a block and I couldn't even reach that far down. But that was the only real respite that I would get for the entire day, just getting to lie there for like 20-30 minutes. She then opened up the door and let Martin in to help me get cleaned up. I was covered in blood again by this point. A guy came to get me and wheeled me back into the hallway, and as he was pushing me down the hallway, I was very drained at this point, but I started to notice a gurgling in my stomach, and it very quickly moved lower and lower until I realized I was about to poop myself. At this point, I was going out in the middle of the hall surrounded by what felt like 100 people, and I yelled, "I need a bathroom now! Right now!" He wheeled me right into a private room that had a bathroom, and I ran in. Now, this is the part, looking back, that was kind of comical, but in the moment, it was not. In the moment, it was a horrific nightmare. I start projectile shitting. And I very quickly realized that the toilet is so high off the ground that my feet can't touch the ground. So I'm like clawing at whatever I can find to get off the ground. And trying to keep my body upright because of how high the toilet is, and I'm like almost vertical and I can't like shit properly. So after a few probably seconds of painful struggle, I scream, "Why is this toilet so high?" And Martin runs in, and I tell him I need something to prop up my feet on. He looks around and can't find anything, and then finally he pushes the wheelchair up against me and locks it up, and it was perfect. And it was my saving grace. And then I was able to projectile diarrhea for what felt like 20 minutes. And during this time, though, I'm still waterfall bleeding also. And because I am on the toilet, I can't stop it. So as the minutes tick on, I'm fading. And this is where Martin loses it. He sees that I'm close to passing out and he starts freaking out. I tell him, stop. I'm like, I've been holding it together this whole day. You need to pull it together. Because if I pass out, I'm gonna need you. By the way, the smell was horrific. Horrible. Once I was finally done, I started to clean myself up. Again, very difficult. Being that the only thing in there were paper towels, the guy that wheeled me in there told Martin he was gonna go get the nurse. Subtext being not my job, peace out. The nurse came and gave Martin some wet wipes for me to clean myself up. That took a little bit of time. Again, like, people are annoyed with me, but I'm like, this is a nightmare. And I should have realized at some point during the projectile shitting that it was the suppositories. And I did realize it at some point, but anyway. So then they get me back into the wheelchair and took me back to my starting position in the hallway. And as we sat there, not knowing if I was gonna have to go into surgery or not, eventually the resident doctor and the nurse came and told us that the sonogram showed us everything was clear. I don't need surgery because everything came out from the pregnancy and that I was fine, and that I just needed this medication. And Martin proceeded to ask them multiple times, are you sure? Is it 100% positive I don't need the surgery? And they said yes. And I told them that while I was in there shitting, I did drop another giant clot. And this resident doctor says that's totally normal and fine. So we don't understand why they even scraped out that clot, which made me bleed infinitely worse. Why didn't they just leave it alone, do a sonogram, find out exactly what they ended up finding out, that everything was fine, and I just needed this medication. And the poking and prodding was not good for my health. I'm exhausted already just like recanting this story. Oh, I hate hospitals. We also asked if me shitting out the suppositories would make any difference, and they said it wouldn't, and it was probably in there for like 40 minutes, and it came out, so it was probably absorbed by that point. So at that point, when we found out that their sonogram showed exactly what the other sonogram showed and that the two matched and there was nothing wrong, we were pissed. They should have just done the sonogram in the first place and given me the medication, and I could have left instead of putting me through this HE double hockey sticks. So they had me hooked up to an iron drip and finally gave me food, since I guess they determined I didn't need surgery. And this was probably around 12:30 a.m. and the nurse told me the drip would take about an hour to go through, but at this point all I wanted to do was go home and go to bed, and I asked if we could maybe do half the bag. The nurse said she would ask, but she didn't. And just as a reminder, you know, Martin's dad had been there since 4 o'clock waiting for us. It's now after midnight. Also, you know, Martin and I weren't planning on like spending the whole day at the hospital, so our dog Rocket was home alone the whole day. So besides being unbelievably tired, there were 2 other reasons why I wanted to leave. One, Martin's dad came to pick us up at 4 o'clock, and he was probably prepared to wait a couple of hours because he was a very nice man and that's what he does. But at this point it had been about 8 hours, and it would be at least 9 before he actually got to leave. It would also be an hour and 20 minutes to get us home from the hospital, and then another hour for him to get home, and he had work in the morning. We did tell him several times, please stay the night with us. You know, we also told him throughout the day, please leave, like we'll get an Uber home, it's fine. But he was so worried about me that he stayed. And then he wouldn't spend the night with us either. He wanted to get home to his wife. The second reason that I was so eager to get home is because Rocket, our dog, had been there all day long by himself in his crate, ever since Martin left. We did have our neighbor come over and let him out a couple of times, but I just couldn't stop thinking about him. Finally, they brought me one of the pills that I needed around 12:45, and this is when Martin and the resident started having a disagreement. He was convinced that there were 24-hour pharmacies. Martin looked through his phone and he knew there were not. He looked at Martin's phone and pointed one out and he said, this one says 24 hours. And Martin was like, okay, call them. And if they are, send the prescription there and we'll pick it up tonight. So he called, he came back and he was like, you were right. I guess the pharmacy isn't 24 hours. So he had the subscription sent to the Stop and Shop by my house, but I was supposed to take this thing every 4 hours. And I had already taken the first one. And for whatever reason, he was kind of combative about giving us 2 more with us just to last through the night. Martin had to talk him into it. I finally finished my iron and they told us they would get the discharge papers. The nurse unhooked the drips, but did not take the implement out of my arm. I felt like we waited another 25 minutes before they brought the discharge papers and the 2 extra pills. And Martin asked the resident doctor, is it in the documents why you decided not to do the surgery? Is it in the documents that the sonogram basically showed what the other sonogram showed? And he said, no, that's all in the internal hospital notes, which was pretty annoying to hear. In the meantime, I tried to flag down the nurse a couple of times because she didn't take the thing out and it was really hurting the whole day. I'm like, ugh, I know it seems like such a stupid thing, but like it really hurt. And I did ask my doctor and he was basically like, she'll get to it when she gets to it. It's super condescending. So we waited maybe another 10 minutes before the nurse finally came to take the implant out of my arm. We were finally free to go. We stopped by the information desk on our way out to see if we could get an itemized bill. We could not. It's now been a couple of months and I still don't have a bill. So I don't know what this whole journey is going to cost me. I was incredibly grateful that Martin's dad waited because I was finally able to lie down on my side, which is the only way that I was comfortable. My gyno called me the next day and said all of my blood work was fine. So as it turns out, there was no need to go to the hospital. And both sonograms showed that it wasn't an ectopic pregnancy. All I needed was this medication, but instead I was basically bled dry over the course of 12 hours. I'm taking a page break here to talk about today, and then I'll get back to talking about yesterday. So I'll start from when we got home last night. We got home around 2:30. Martin's dad had waited around for us at the hospital since 4 o'clock. I was so grateful to be able to lie down in his car. We tried to get him to stay the night, and I already said all this, sorry. Okay, so after I basically mommy gushed over Rocket because I felt so bad for leaving him all day long. My poor baby. After that, I stripped off my disgusting clothes, threw it all in the wash, and took a hot shower. And all the aches and freezingness from the day came back full force. I was shaking uncontrollably. I had a really hard time doing anything after that. It was like, I mean, my body was in shock. It was trauma, you know. It took a lot of starting and stopping to get ready for bed. I made us both cup of noodles, and I finally relaxed in a giant blanket and robe on the couch. I slept in the office with Rocket, mostly because I couldn't bear to put him back in the crate. I took one of the pills they gave me at 5 o'clock and fell asleep, and then another at 9 o'clock and fell asleep, and I woke back up at noon to be able to go get my prescription to take at 1. But they didn't have it. They wouldn't be able to get it until the next day. It's also not covered by my insurance. It was $310. So we started calling around to every pharmacy in the area. No one had it. Then I get a call from my gyno, or the PA. I tell her everything that happened yesterday and that we can't get this medication and that they said I needed so bad. And she tells me that she has escalated my case to my actual gyno, the one who is in charge of the whole franchise, who I, at this point, haven't seen in years, because she was very worried about me and that she was messaging with her in real time. The gyno didn't believe I really needed this medication based on the results that I got back and what they did to me in the hospital. She scheduled me for a follow-up blood work on Tuesday. Oh, a little note here on the side. It was apparently a rare old drug that no one carries anymore. Even the hospital was prescribing me a drug that if I desperately needed, I wouldn't be able to get for a full 24 hours. Martin even called St. John's Hospital, which was a hospital nearby us, and they didn't have it either. This whole thing's so annoying. I'm honestly feeling worlds better today, but I can't stand for very long without getting lightheaded, ear ringing, short of breath, because there's just not enough blood in my body. I'm anemic now. I did not know what that word meant until this whole experience. Next day, took it really easy on my body, had a headache all day, but I feel so much better. I took a nap after work. Next day, experienced extreme tired today, like never before. Took 3 long naps. Could be my hormone levels dropping back down, trying to get to normal. Also could be caffeine withdrawals. I surprisingly haven't had coffee in 5 days. I had decaf today just to see. Had a horrible headache all day. Next day. This is October 6th. I feel so much better today. I'm still bleeding, but very minimal. Still getting headaches every time I stand up, but it's manageable. Actually gave Martin a little action today. October 7th, minimal bleeding, mostly spotting. Still have extreme headache when I first wake up, but other than that, I'm feeling pretty good. You know, in hindsight, this is all because of like an iron deficiency. I'm losing so much blood. I'm still bleeding. October 8th, very minimal bleeding. Probably about done now for realsies this time. Still getting headaches from the iron pills and black, chalky, tar-like poos from the iron. Really don't think I even need the iron supplements anymore. Bruise finally showing up on my right arm where the nurse put the IV in. Yeah, I bruised like much later than injury. October 9th, could not get to sleep last night. I really don't know why. Probably drifted off around 6:30 or 7 a.m., but didn't stay asleep. Woke up at 1:45. Extreme tired. Not sleepy though, just extreme tired. Didn't take iron today, didn't want the headache, but still clearing it out in my poops. Minimal bleeding. October 10th. So, the follow-up appointment that the PA told me she scheduled for today was not scheduled. I called and rescheduled it for the next Tuesday, but I might have to try and go again tomorrow. I also had a telehealth appointment today where I tried to ask this very condescending lady that I won't name, if it were possible to test the DNA of the clot that I saved to see if it was actually twins, because I was informed that because my hormone levels were so high, it was probably twins. She didn't know. I'm so over this gyno. Next day, October 11th. Went to the gyno again, did urine test, got taken into a back part of the office that I didn't even know existed, did my vitals, got taken into a room where new PA did my exam. She asked if I was still bleeding, and I told her not actively, but whenever I go to wipe the bathroom, there's blood. She said everything looks good and cleared out, but she couldn't check to see if there was any scarring from the hospital yet because I'm not entirely done bleeding and it could be a false result. Then I got blood work again, and I actually walked past my gyno. She was there. By the way, she has like 5+ locations, so she's usually in Manhattan, and the place that I go to is in Queens. They were about to check me out and send me home. I was already calling an Uber when the PA came and caught me and said they actually could do the sonogram there today if I still wanted to. So I went back into the waiting room for about 45 minutes, did the sono, and asked if I could speak to my gyno before I left, since I never get to see her. So I did. She asks how I am, I tell her I'm fine, and then she asks what my plan is for sex, and I tell her, well, we want to have a baby really soon, but like not until I've had a few periods first. That was always the plan. And then she recommended I go back on the birth control pill, at least for a while, but she couldn't really explain to me why. She was telling me that part of this month-long bleeding could be my period, which makes no sense to me. I'm pretty confused and frustrated again because my effing doctors have no answers. I have an annual appointment for another month from now, which I couldn't get done today because the insurance won't cover it because it hasn't been a full year yet. I did tell my gyno how horrific the hospital experience was, and she totally trashed the medical system too. And then she gave me a hug. And I forgot to tell her that ever since she franchised, the system is all over the place and I can never get any straight answers. I'm trying to skip ahead here in the journal and see when I actually stopped bleeding, and I haven't gotten there yet. October 24th. I just want to keep track that I've called my gyno and asked to have her call and speak with me. Called on the 19th, called on the 23rd, called on the 25th, no answer, sent an email. I got a call back, had a telehealth appointment with a gyno. It's a PA again. She told me my HCG levels were still very high when I was there last, so I probably wouldn't be getting a period for a while. Told me there's no real reason to go back on birth control. So now I'm getting two conflicting opinions about going back on the pill. And I still don't understand the logic that my actual gyno was trying to tell me. See, the whole point was, because I have not had a natural period with my hormones being at normal levels for decades, the plan was to have a couple of periods before we actually get pregnant. That way we can make sure that it's a viable pregnancy and that, you know, everything is safe with me. Yeah, this miscarriage was a surprise. And I think I'm about wrapped up here. Yeah, I don't know how long I went with actually still bleeding. I don't know. But this has gone on long enough. So yeah, yeah, so the miscarriage was a surprise. You know, Martin and I have talked about it several times since then, just to kind of check in with each other. But since it was, you know, we didn't even know that I was pregnant, it kind of didn't feel like a loss. But, you know, it's been a couple of months now. We're still, like, checking in with each other. It was a traumatic experience for both of us. Like, Martin kind of got, like, really sick. Not sick, but, like, he was standing in the hospital the whole day with no place to sit down in dress shoes, and he didn't eat the whole day. Even when they brought me food, you know, I offered him some. He didn't eat. He was so stressed out trying to make sure that I was okay. So yeah, it was really traumatic for both of us. I hate our healthcare system. It sucks. And this is why we want to leave. Move to a different country. So that was my nightmare. Don't be on birth control pills for most of your life, ladies. It will screw you up and it will make sex horrible. Yeah. So I guess stay tuned. You know, we're trying to get pregnant. So hopefully that happens soon, because I'm an old and it's time. All right, bye.